Hi, this is Charles Di Bartolo with the Better Staten Island. We're here today with Kate Rooney of SafeHarbor Healthcare Services. Kate has been a practicing attorney on Staten Island for 45 years. She's also been special counsel for 30 years with Staten Island Senator John Markey. And Kate's been intimately involved in the Staten Island community, especially through SafeHarbor Healthcare Services. And I thought this would be a good time to educate people on what to do when maybe your loved one, one of your family members or older family members is having an issue health-wise and might need some care, and what you need to do to decide whether that makes sense for you or not, and what your choices are. So Kate, let's start with a high-level description of home care services and what people go through, given what you've seen.
Well, thank you, Charles. Thank you for having me. It's great to be here. Let's generally talk about home care and the services that are delivered in home care. Broadly, it's skilled nursing as opposed to a home health aide. Skilled nursing would be RN, LPN, home health aide, personal care. Sometimes people call it a companion. Obviously, there's another array of services that can be offered in the home, physical therapy and other kind of rehab. When you think about home care, often you think about what is the difference between home care and a skilled nursing facility. Obviously, you know the difference. One's at home. But a lot of times people, when they're assessing their need or a loved one need, looks at what's the best place for them. And there are skilled nursing facilities, there are assisted living facilities, there are facilities throughout or programs throughout. There's a vibrant program in New York State called the PACE program, the program for all-inclusive care for the elderly, which you stay home, but it's a Medicare and Medicaid product. So, well, you have to be eligible for Medicaid, but it's a program where there's a daycare, also social workers, medical attention. That is really catching favor throughout the state, and if a person is Medicaid eligible, that could be a way to stay at home and also have an array of services. In terms of home care, there's broadly, as I think most people know, the difference between Medicaid, which is for people that need financial assistance, Medicare for those of us over 65, 62 or 65, 65 for Medicare. And there's also, obviously, other methods of paying for home care. There's what happened about 20 years ago, and now it's coming that people are having the benefits, or long-term care insurance started that can cover a person staying at home. There's also a number of programs that sometimes people aren't aware of. Veterans Administration has a home care program that will pay for home care. Teachers unions have a home care program. So there are sometimes services, money that is available, that if people look into it, they might not even know that upon retirement they got a long-term health care insurance.
Right.
So I think that's very important for people to understand that. But in general, when people talk about home care, they talk about either skilled nursing, which is for chronically, seriously ill people. Often a fragile child will have Medicaid, and then Medicare covers home care, limited to usually after hospitalization or for a while of a home health aide.
Right. And now, what does your company specialize in?
In skilled nursing, home health, and home health, although I think we're going to be getting into physical therapy too. But at this point, it's basically having skilled nursing for either the chronically ill, seriously ill, for short-term after hospitalization. Right. Sometimes there's approval from a health insurance for wound care, for like a once-a-day nursing visit. But generally what people need when they stay at home is a home health aide, personal care assistant, someone to help what they call the activities of daily living.
Right.
Help with hygiene, meal preparation.
Keep up the quality of life.
Yes, yes. Remind somebody to take medication. Home health aide cannot give medication. It has to be poured by a nurse. Right. What we do at SafeHarbor is that our nurse will go out on a regular basis. We don't charge for that, and they call it pour, but put into Monday, Tuesday, Wednesday, and a home health aide can remind someone to take the medication. So It's basically to allow somebody to stay at home with some help.
Okay, so let's start with the biggest fear that everybody always has is cost, right? So let's say they're not covered by anything. Let's start with the worst case scenario, right? And they, what does it cost to get somebody to help you out in the
A
home?
home health aide, we charge now $32 an hour.
Okay.
Which I know sounds, to a lot of people sounds like a lot of money, but the margin really is very, very
Minimum
small.
wage is almost 20, so.
And it's not just that. Because we are a licensed agency, and this is what it makes it more difficult maybe to compete with someone who's not a licensed agency.
Right.
But obviously, we have every insurance that you need. We have extensive employee credentialing with criminal background checks, with training. And so the cost of doing business is obviously protection of the community, of the consumer, but also obviously we need to have malpractice insurance and insurances that cover, the payroll insurances that cover the employee,
Right.
but also obviously that cover the patient if there's a problem.
Okay, so now if someone doesn't know what they're eligible for, what they can do they come to you? Do you kind of act as a coach to let them know
Oh, sure.
what's available?
What happens, and we get these calls, daily, and usually it's a coordinator that answers, but we'll pass it on to an insurance specialist or to one of our nurses, is if we give them obviously the broad, you can make a phone call and we can tell them broadly whether or not, if someone is looking for, is in the hospital, for example, and looking for some short-term, going home looking for some short-term help, either with skilled nursing, with an RN, or the home health aide, we will direct them to a certified agency like a BNA.
Right.
Because they will have the program put together where they can, through Medicare at this point usually, and maybe Medicaid, depending on how somebody is, but it's also through their private insurance.
Right.
Your private health insurance will cover home care for a skilled nursing visit if a nurse is available, because obviously they'd rather have, the insurance company would rather have you at home than in the hospital.
Right.
Having a nursing visit,
Much
let's
less
say.
costly.
Exactly. Nursing visit once a day. And they will cover for a short period of time a home health aide. If a doctor says, we can get you home from the hospital, but only if we have somebody there for a nursing visit a couple of times a week and for a home health aide, that insurance company, Emblem Oxford, will cover the home health aide.
Right.
So, but that insurance company, unless there's skilled nursing care is needed, will not cover a home health aide.
Right.
So we'll cover it for the interim. Now, what often happens, and especially in New York State, as I'm sure that people are aware of, is very generous in their Medicaid program. Although, if you look at the governor's budget in the last couple of days, they're trying to pull back on it because they probably have been sometimes overly generous.
Right.
But there is something called community Medicaid. And basically, there is a spend down. It's not the kind of spend down that you have to go into a nursing home. All your assets have to, and so there's a period of time that they can look back. But you could be eligible if you do a Medicaid planning, to be eligible for Medicaid at home. And that would be and those are the kind of things that, yes, our office would be happy to point you in the right direction. But we are often telling people that call on the phone, go ahead and give a call to VNA, because maybe they can put these kind of services together, and we can sub with VNA to provide, for the limited period of time, the home health aide, and that would be covered under the VNA's program.
So is there a time when somebody should come to an organization like yours or an organization like VNA's? What separates that?
Well, they would probably call VNA, they might call VNA first, and
Right.
depending on whether or not VNA or a similar program like VNS has a program that they can access, they can say, you really are not eligible.
Just for the community is Visiting Nurse Association.
Right.
And Visiting Nurse Services. Right.
One
So
is
just so
one
people know.
is big.
Because you live it every day.
I'm sorry.
Right?
I think longtime Staten Islanders think of VNA,
Right,
because
yeah,
that's
they
a
know,
long-time
right, they know
organization.
the
Now,
name.
VNS is a fine organization too. That's in all 5 boroughs.
Right.
VNA of Staten Island is just on Staten Island.
Right.
But often they'll call us back and say VNA says they really don't have a program that can help. So then they want to talk to us about privately
Right.
hiring us.
Right.
Now, then that's when sometimes the detective work starts, because there's often long-term care insurance that will cover an insurance policy that will cover, it's like a Genworth or a Metropolitan, will cover home health services for an aide. Veterans Administration has a program. Teachers unions have a program. A lot of other unions have programs.
Right.
So we've got to really, when you talk about, and often it happens that people don't call until they need the service immediately.
Of course.
What the best thing, and if I could impart one thing to the viewers today, would be in planning, it'd be a wonderful idea if you could sit down either with your own insurance that you have, or doing a little bit of research about what might be available, or if you're talking about a loved one, sitting down and figuring out what kind of insurance you do have and what might be covered. You know, with long-term care insurance, and there are a number of wonderful ones around, and the benefits can be substantial, but there's often and this is counterintuitive, there's also often a period of like 90 days where you can't access it for the first 90 days. Somebody called us once and really needed the help. We looked into the policy for her, and they said you have a period of, you've got to start it now, get the approval, but you can't access for 90 days.
Right.
And that poor woman couldn't use the facility, because within 90 days she had already passed away. Wow. So you really have to kind of look at what you have, to look at what you, how you start the process. So that's the recommendation that we would make, but that's the kind of thing that somebody would help at the office.
So let's talk about reasons why, because now we're already getting into the process, right? But reasons why someone should be considering your services, why they should plan to have services like this, and instead of waiting until it's like they have to have it. So what are the signs? What are the, tell me a little bit about the type of person that needs your help and so forth.
The typical person that leaves, except for somebody that might be coming out of the hospital, that can be obviously any age. And coming out of the hospital, if I can just stay with that for a second, coming out of the hospital is often the time that they need the help immediately. You hear all the time about readmission to a hospital and how devastating that can be.
Right.
So someone comes home from a hospital, let's even say, not a senior citizen, and needs help and doesn't get help with checking their vital signs, with making sure the medication is done, with whatever has to be done that a home health aide could do. That is the time that often they go back into the hospital. With an elderly person, often the chances of another heart attack or another stroke, I think the medical documentation is that most people that have a stroke will have another stroke within a year. So you got to make sure that once they get home, they're going to stay home and they have the care, maybe intensive care for those couple of weeks. But the signs generally, if somebody has not had an incident that they're hospitalized for, it's the obvious things. Maybe is the falls. Maybe you're going to visit mom and you realize that the pills are still there and she hasn't taken the pills. Little things like is the food fresh in the refrigerator? Has the food been eaten? And ever since COVID, but even before that, there really is a mental changes in mood and mental health. Sometimes it's just a natural sign of aging, maybe a little bit testier, maybe.
Well, I'm getting that way now.
Yes, exactly. But there are little signs like that, and I think the reason that maybe you want to start, at least when talking about planning, maybe at least talking about it, is because once somebody really needs the help, there's also there's a time, there's a resistance to it.
Right.
And
I'm just going to stop you for 1 minute. We're going to take a 1 minute break, and we'll be right back.
Right. Thank you.
Thanks.
What makes essential workers essential?
We keep where you work and live clean and safe.
We harvest fresh produce for your families to eat.
We help you heal when you're sick.
Essential workers help our nation run. You're in every corner of our country and come from all over the globe. I'm Marty Walsh. The Wage and Hour Division at the Department of Labor helps ensure you receive the essential protections you deserve. Visit our website or call 866-4US-WAGE.
Brought to you by the United States Department of Labor.
What is dementia? Is it the same as Alzheimer's? If someone has memory loss, does that mean they have dementia? Millions of Americans ask these questions every day. Hello, I'm Kevin Jameson, volunteer and president of the Dementia Society of America. Please request our free guide filled with facts about dementia and ways you can keep your brain as healthy as possible. Go to 1-800-DEMENTIA.org or call 1-800-DEMENTIA. You want to live your life to the fullest, and we can help.
Hi, this is Charles Di Bartolo with the Better Staten Island. We're here with Kate Rooney from SafeHarbor Healthcare Services, and we were just going over the different illnesses that people may have where they may need home health care. And you had started, what was the one we just left off at? Just so I can...
Do you see? I don't.
Okay, stroke. I think it was stroke.
Well, stroke
right?
was a discharge from a hospital.
Right, discharge from a hospital, and then you were getting into stroke.
Right.
So let's start with that.
Well, if we stay with discharge from the hospital, obviously it's not just a stroke, but sometimes there's been a broken bone, and that when someone goes home would need help with physical therapy or with just getting around. So that's the time that you'd need some home care. But the idea of illnesses in the elderly, I think, is also important, not just for needing home care, but for another loved one assessing whether or not you should really start talking about home care. Right. You know, as we age, there's obviously indigestion problems. There often, especially in a woman, are UTIs, urinary tract infections. And the reason I mention that is because that can lead to a fever, and it can lead to confusion. And often the good news about that is that if that's treated, if somebody recognizes the sign of that and that's treated, the confusion often goes away.
Right.
So that pneumonia is also obviously another illness that often has somebody need home care, any kind of lung disease, because you need help getting around and also making sure. I guess we're much more aware of this now with the COVID pandemic, and that is that there are certain signs of respiratory conditions that need attention, and I don't necessarily need home care, but need the person that's having it or a loved one realize that somebody needs the help. But you know, there are natural signs of aging, and there are times when you need to have some kind of intervention, whether it be medical or with a home health aide. Right. Skincare issues. I think that the whole idea of knowing about what the normal or predictable signs of aging are is that for people to assess whether or not they need to have medical intervention, and therefore whether or not if we're on a road that maybe means that in 6 months or a year, mom and dad are going to need somebody at home. And the reason that planning is so important for that is that it does take time right. for someone to get. So maybe the idea would be convince mom and dad that have somebody come into the home a couple times a week to right. do a little bit of cooking for the week and maybe do some shopping or that type of thing, just to get somebody used to being in the house. So they'll
do that too. The people that you have will help
sure.
cook. They'll do things like
sure.
that.
And also in terms of shopping, we've had a number of cases where the office takes responsibility for getting for getting the delivery over there. Right. So that often happens if you don't have loved ones close by that can help. Right. We have a number of patients whose children are in other states or who are a widow or widower. Right. And so they don't need 24-hour care, but they just need somebody to kind of manage.
And that's the thing. I think a lot of people are afraid that they have to hire somebody 24/7,
yep.
full-time.
Yep.
What's the average?
Well, the average...
I know it changes according to...
It does. I would say the average home health aide going to a person's home is probably 4 hours a day, maybe 5 days a week, maybe 3 days a week.
Right. So they do have a choice in what...
and
sure. They can coordinate it, that they can help and you can help, and because a lot of people can't afford full-time.
Oh, no. Right. I mean, it obviously gets to be very expensive. There's no doubt about that. But when you think about, and that's why planning is so important, planning of the caregiver, hopefully for everybody's sake, there's more than one caregiver. Right. I'm talking about a family member and
right.
non-paid caregiver. You can have, because there is a lot of caregiver burnout going on.
Yeah, and there's a lot of reluctant caregivers too in families.
Oh well, there's no doubt. As we say, sometimes there's a number of brothers and sisters that are taking care of mom, and our code is there's somebody that's not playing the game.
Right, exactly. And that brings up another thing. I have family move to Florida. I'm sure you get this a lot, and you may not want this question, but somebody's living on Staten Island all their lives, their parents move away, right? And then they need help, and that's usually what happens. They retire, they move away, then there's nobody to help them out there. Can they go to you to get a referral for somebody
Oh,
in another
sure.
state?
We do that all the time. There's no doubt about that. I mean, but basically, I think we would. I can't say there's one or two agencies in Palm Beach that we know.
Right.
But I think the advice that we would give is let's go online, let's talk to other people, let's see exactly what kind of questions that you should be asking.
Right.
You know, when you get back to, I would like to mention one other thing that really has nothing to do with going to Florida, or it has to do with planning, and I think that this is so important. There are a lot of things that a caregiver of a family member can do in planning that you don't need an attorney for example. I mean, as an attorney, I'm telling you this.
Right.
Like a power of attorney, there's a statutory New York power of attorney. You print it, you can fill it out. You have to go to a notary, but other than that. Living will, which basically tells what you'd like to do in terms of advanced directives, do not resuscitate. A healthcare proxy. The two things you really should have are power of attorney and a healthcare proxy. I give my daughter, my son, the ability to make the decision for me.
Right.
Those two things, you don't have to worry about. You don't have to worry about setting up an attorney position, changing your will, or doing anything like that. Those two things everybody should do. They should have a list of medications that mom and dad are on, the doctors that they're on, and then if there's more than one family caregiver, maybe kind of sharing duties.
Right.
You know, we were able to keep my mom home for, you know, after she had dementia for about 6 years. I mean, it helped that we had a home care agency there, but someone was there from the home care agency from 9 to 5, but then one of us took over, but we had different roles.
Right.
My sister's a nurse, so she took care of that.
Right.
My brother's in the construction
You're lucky
business.
your sister's
Yes,
a nurse,
exactly.
right?
I was considered the enforcer.
There you go. That's funny.
Well, I didn't like that role, but Mom used to say, there's Kate, she's the boss of us all.
There you go, right? So tell me, how would someone shop for a good home care agency?
Well, there's a lot of good ones on Staten Island. I believe SafeHarbor is like the best small premier agency. The idea is to make some calls. You have to feel comfortable with the office, too.
Right.
A lot of this is responsiveness. You know, the office has got to be 24/7. Just ask some questions. Do you do, do you do a free, a courtesy nursing assessment or plan of care?
Right.
A nursing assessment is not just about medications, it's also about assessing the home in terms of safety issues, you know, rugs, where should you move a bed, what should you do about certain things. Plan of care is exactly listing what you should do. So you've got to feel like someone calls you back, is responsive to needs, and also that they're a licensed agency, obviously, Department of Health, licensed, insured.
Are there a lot of unlicensed agencies out there?
Well, it's a lot of, you know, there's a couple of agencies out there that they're not licensed by the Department of Health because they claim they're not doing any kind of personal care.
Right.
That they're just a companion. So, so if you're a companion,
that's got to be dangerous.
If you're a companion and I'm here just talking to you and I'm going to get up and make you a cup of tea, that's great.
But there's no checks and balances.
Well, there's also, but it also is I'm here and you go to fall, and I do have to help.
Right.
You know, or I'm
not qualified to help.
Exactly. I have to bring you into the bathroom or that kind of thing. You know, but I'm not going to say there's not a niche that somebody might have to drive somebody to the doctor to do some shopping.
Right.
But there's a kind of a gray line there that you really should be a New York Department of Health licensed home care agency.
Right now, and being licensed, I'm assuming there's background checks, things like that, right?
Background checks, screenings.
And that's so important today.
Well, also in services. The Department of Health mandates, in addition to the training, 12 additional hours a year of in-services on like the latest things that are happening and what you should do. There's a lot of discussion now about mental health and about loneliness. You know, putting music on. You know, because with dementia patients, that's a big. It's amazing, and they've been doing this in nursing homes for a year. But it's amazing how that can help in terms of memory and making sure that you're not as lonely as you were before. Music is a big thing.
Wow, see that? So that whole baby Mozart thing comes back, right?
It depends on the era, I guess. That's true. That's true.
Funny. And what about trends in home care today in New York? Things we should know?
Well, there is, you know, as I said before, we're a very generous Medicaid state. If you do any kind of reading over the next couple of days, you're going to talk of Governor Hochul's budget talks about a lot more money, perhaps for nursing homes and assisted living, but not for home care. You know, there is one trend I'd like to just point out that's not in healthcare, but I read it in the Times this morning, and it reminded me. And the article was about scams and the elderly. Right. And this one happened to be a dating scam, and it was someone who was in her. But that's happening more and more with regard to an elderly person picking up a phone, or this person happened to be on Facebook, and having someone befriend them, say they're in a foreign country or they can't come visit, and there's money being exchanged for someone to come and visit, or I think that when you start to have a conversation with an elderly loved one, the idea of being aware of the kind of scams that are going on. I mean, we read about it every day. Many, yeah. And they're so sophisticated. Yeah. The one about I'm calling from Con Ed, and if you press a button, if not, we're going to turn off your. Yes, I've heard it. Yeah. Yeah, I've heard it too. Amazing. I almost fell for it. I thought to myself, did I pay the Con Ed bill? Wow. And I mean. And don't ever press the button.
Sitting home alone. And,
what you can say to them is don't press any button. Wow. You know, don't say yes or no. I mean, that's the message that you can send. Wow. And again, I bring that up as trend only because it certainly fits into what's going on now and something that we should be talking to our loved ones about. Right. Yes, absolutely. What else should people know? What else should people know? I guess we should know that there is a joy and a benefit to living as long as we've been living. There you go. And a joy to be able to help a loved one as they age. And that I think the most prepared that we can be would be the best thing in terms of starting conversations. When you start conversations, making sure maybe that we talk about goals as opposed to what we're going to do right now, but what is the goal of maybe like eating better, or going out a little bit more, or having somebody be there that can help during the day. So I think what happens most of the time is you need home care maybe in an emergency, and it would be nice to be prepared before that emergency. I think that's probably the message I'd like to give. And how would you handle resistance? Because I would think that's the biggest thing today, right? Everybody's used to being independent. They want to be alone. They don't want somebody cleaning up after them, taking care of them. They want to know that they can do that. Well, yeah, well, now. Yeah. Right. But when it happens, it's different. And so how does someone approach a loved one to say, hey, maybe it's time? Well, you know? It's a conversation that takes time. And often when you start to need, it's a little bit more need, and if you're lucky enough to have family members that can come by, if you come by more often and start doing things with them, I mean, that could be a double-edged sword, because maybe I only want her to come. Right. I don't want somebody else. But if someone gets used to a family member or someone else coming in, and instead of preparing the meal, prepare it for them. Right. Or instead of them going shopping for them. That sometimes gets them used to having help. That's not it often works against it. And look, everybody is so busy, and there's people younger than I, much younger than I am, that are in the sandwich generation that are taking care of young ones at home, and an elderly parent. So it's hard to find the time, but spending more time, and when you're there, doing things for them, gets them kind of used to maybe having somebody do it for them. Well, it's been a pleasure to talk about all of this. I'm glad we could get this out to the public. This is Charles Di Bartolo and Kate Rooney at A Better Staten Island, and we want to thank you for your time. Thank you. Thanks for having me, Charles. Thank you. Thank you.